Welcome to Connect the Dots Learning Center podcast. I'm Stephanie Wagers, your host, and I'm so glad you're here. Whether you're a seasoned therapist, clinic owner, or just starting out, this podcast is your go-to spot for insights, tips, and stories that'll help you connect the dots in your practice. Welcome to the Burnout series. Today, I want to challenge you what you think burnout looks like. Most of us picture long hours, too many clients, endless paperwork. And yeah, all of that does matter, but that's not actually what pushes providers to kind of go over that edge and come to you and say, I'm burnt out, or I need to reduce my hours. All of the practice owners on here are dreading those conversations with their providers. So, what really drains people, what truly bakes burnout into your clinic, is the therapist feeling like they're doing it alone. Each episode, we're going to capture a different layer of this problem, from culture to the emotional labor that providers go through to training gaps. My goal is to help you see burnout differently and to fix it for your sustainability of your clinic, and if you're a provider, for your longevity in your career. So let's get into episode 1. So let's just take a look maybe into the provider's day. So they walk into the building, they're excited about starting their day. They've got a great obstacle course planned. Their first patient arrives late. They're having difficulty transitioning into the session. The parent finally gets them in the session. Their parent's phone rings. They step out to take the call. Now the provider is stuck having to manage the child and their meltdown. So anyway, they make it through the session, but then again, the child has difficulty transitioning out. The provider's trying to have a conversation with the parent about maybe something to try at home or how the home program went. Child screaming, and it's mayhem. They're already thinking, oh my gosh, now my 10-minute block where I can clean up, use the restroom, and document just got pushed down to 3. And my next patient is already waiting in the waiting room. So it creates a sense of like anxiety. So if we multiply that by 6 or 7 patients a day, you can really start to see where the therapist exhaustion really builds. There's no moment of reset for that therapist. No help, no carryover, no real meaningful collaboration or check in with families. It's all around a stressful transition of the child in and out of the session. And that constant emotional juggling, it really wears us down. When the provider allows the parent to not be present in the session, burnout starts to creep in. When the provider functions this way and the parent's not in the room, there's no real moment of reset. There's no the parent taking over and managing the game while the provider steps back to change a part of the obstacle course or get a different game out. They're in it alone. They're managing the child. They're having to think 3 steps ahead, and they're trying to stay in the moment with the child, make it play-based, neuro-affirming, and fun. Burnout isn't just tired, it's feeling isolated. It's when that therapist feels like they're doing everything. They're the only one holding everything together. Every time that provider is left to manage the meltdowns, the communication with families, the cleanup of the sensor room, the explosion of the rice bin, even taking the child to the bathroom because the parent stepped out to run an errand, all of those take a toll. And what's worse, when those home programs they worked after hours on didn't get followed, and the parent continues to ask for the same thing over and over, and they're still not following them. But even worse than that is when progress stalls because they're not working on what they need to be working on. So the therapist feels like, I need to try something new. They try something new and that doesn't work. And then it begins to feel personal. The therapist feels like, I'm not good enough. I'm not doing what I need to do, instead of realizing that it's a result of it not being a team effort. That isolation isn't just emotional, it's structural, meaning how your clinic is set up. I know that might be hard to hear. I've had to look at it from my own clinic and I had to flip everything on its edge. I'm here with you and I'm hoping to coach you along the way to give you some tips. So let's talk about what's really causing therapists to burn out. Parents aren't participating like we need them to. I know some people aren't going to like hearing that because, yes, parents are stressed. Yes, they have a ton on their plates. But let's face it, we are not getting paid to babysit. Don't freak out. I know you're doing way more than babysitting when you're working with a child. But when we allow or encourage or, become that respite service for that parent, we're not doing them any good with teaching them what they need to know about their child so they can carry it over at home. I know a lot of people have different views on this, but we are not a respite service. We are a therapeutic service. We're billing insurance to treat the child and to train the parent so that they can take home what we're doing in therapy in order to repeatedly practice these skills with their child. We're with the child 1 hour a week. That is nothing when we think about it. If you go to the gym 1 hour a week, you're not going to make any gains. But if you repeatedly do these things over and over and over, progress is going to soar. So we need to be able to coach them on how to support their child. We need to give them the autonomy to do this in those everyday moments. We can't just work one-on-one in a bubble because that's just a band-aid. It's not a solution. So I'll say it again. Parents aren't participating like we need them to. But let's be clear. That's not a them problem. It's an us problem. We need to be clear about what our expectations are when they walk into our clinic doors. If you tolerate parents to be disengaged, they're going to be disengaged. You get what you tolerate. If you tolerate the parent just sitting in the waiting room or dropping off and leaving, that's what they're going to do. They model what they see. If other parents are in the waiting room, they might feel awkward going into the treatment room. If other parents drop and go, they're going to drop and go. That's just human nature. We do what we see. Parents aren't lazy. They just need to be educated on what we want. And let's face it, what we do is so vastly different than everybody else out there. You don't go into your pediatrician's office hours and buddy up to them and look in your child's ear too. No, you're sitting on the sideline. We don't need a sideline parent. We need a teammate. And until we can change that, burnout will continue. So when we allow parents to be disengaged, we just continue to feed that burnout fire. And really, here's the big kicker. When parents aren't following through at home, we're expected to do more. It falls back on us because the child isn't making progress. So we have to up the ante. So we aren't just tired, we're demoralized because what we're doing feels like it's not moving the needle, it's ineffective. We went to school to help people, kids, clients to better their lives. And when we put our all into it and progress is so slow, our motivation goes out the window. We think it's an us problem. We're not good enough. And then maybe we become resentful or we get annoyed at the parent because, well, gosh, if they would just do the home program, things would get better. Here's the hard truth. If clinics are letting this problem fester and they're not training their providers to be able to get parent engagement and to understand parent engagement, then they're feeding this fire and the therapist will leave. That's just a fact. It will happen because this job is not sustainable in this manner. When therapists are taught how to ask the right questions, to read nonverbal cues, to coach parents, to understand the parents, then we can engage the parent. But let's face it, I know I wasn't taught in school how to have hard conversations about spanking your child or letting your child fall asleep to TV, or when a parent of a 6-year-old says, yeah, the child just forgot to do the home program, or sending a child alone in a taxi cab, the parent falling asleep on the floor, or maybe the parent taking over the session. I have a million trillion different scenarios that I know you guys do too. We weren't taught how to deal with that. We were taught theory and practical tips and applications in treatment, but we weren't taught how to engage with the parent. And oftentimes, what is required is to have a conversation about the hard thing in therapy. But what do? We avoid it. Why? Because we're people pleasers. Therapists are people pleasers. It's a blessing and a curse. And we don't want to offend the parent. We know their life is hard. We know that they're doing the best they can. So we don't want to come across as a goody two shoes or a know it all. But when we say nothing, what we're actually doing is causing small, tiny therapeutic ruptures to happen over and over and over. And when that happens, the parent doesn't trust the therapist. And when the parent doesn't trust the therapist, the home program doesn't get done and therapy falters. So here is where you as a clinician or clinic owner need to educate yourself. If you want this burnout cycle to really end, then you've got to learn how to get parents on board. So stop tolerating things that you don't want to happen, that aren't leading to engagement. Start teaching, start coaching, change your policies, speak it in every language across your whole clinic of what you want to happen. One of the biggest thing is teach them to ask the right questions to uncover the real problem. Being a good therapist is being an amazing detective and being able to dig and pry and coach and get the parent to see what they're doing that's actually working and how they can do what you're doing in therapy at home and to really understand that problem. When therapists can bridge that gap between what they're doing in therapy, the activity like being on the swing, to the skill or the problem that brought them in and how it's going to target that and it's going to make it better, boom, fireworks happen. The parent will get it and they're going to show back up because they're going to see that what you're doing is going to help them too as a parent. Maybe they don't have to take off work as much, or they're going to stop having meltdowns every morning when they're asking their child to get dressed. Fixing the burnout problem is a systemic clinical problem. The practice owner really needs to lean in and look inward into your own systems. How are you set up to partner with parents? How are you training your providers? What's your intake process look like? What's your waiting area look like? What is your value with having parents on board and having them involved? So it's time to rethink it because when parents don't feel invited, they don't engage. And when they don't engage, your team carries more than they should. So here's your homework for today. Provider, clinic owner, whatever. Ask yourself, what am I tolerating that is leading to this problem? Am I letting the parent sit out and answer emails in the waiting room? Are you acting as a babysitter? Just some things to ponder. Burnout begins where expectations end, where there's no shared understanding of the parent's role. The provider takes on everything, which is just a setup for resentment and exhaustion.
Stay tuned for next week's episode, where we'll dive deeper into how we get stuck in these patterns, why we continue to tolerate what's not working, and how to begin shifting your clinic's culture, one intentional decision at a time.